Welcome to Exploring the Ethical Frontier, Navigating the Intersection of AI and Ethics in Healthcare. With me, I have some amazing panelists that have a lot of experience in the field of AI and healthcare. I'll start off with introductions. My name is Bessa Bauta. I'm the CIO of the Jewish Board before I was the CDAO of the state of Texas Department of Children and Family Services. With me, I have Asha. Asha.
Hi, I'm Asha Saxena. I am the CEO and founder of Women Leaders in Data and AI, an organization that stands for global leadership in the age of AI.
Next with us, we have Yan.
Hi, my name is Tianyan Huang. I go by Yan, and I am a professor at New York University School of Medicine from Department of Population Health. And I am in health service and implementation evidence-based research. Thank you.
And then the least but the best, Courtney.
I don't know about that, but CEO, I'm Courtney Abercrombie, a CEO of AI Truth. We're a 501c3 AI ethics nonprofit, and I look forward to this panel. What an exciting group.
Absolutely. So I think, each of you have a lot of experience in varied fields and artificial intelligence, and AI, including generative AI, has taken the universe, actually the world, in a storm in the past few years, especially with a lot of developments both in the industry and then taking all of those developments, kind of applying that to other sectors. Today, we're primarily concentrating on the healthcare sector. So we're going to start with, right off the gateway, talking about ethical challenges regarding, how do we think about artificial intelligence in healthcare as well as medicine. So with that note, I know that Courtney has thought about this quite a lot. She has written a book on that. So we'll start with you, Courtney. What do you think are some of the major challenges and ethical considerations of bringing some of these technologies, either positive, we're not only looking at negative, both positive and negative, in the sector?
Well, I would say by far the number one challenge is trust on every single solitary level in every possible use case for healthcare that we could apply AI. What I mean is everything from image diagnostics, we have to be able to trust. Do we know that these were also tested on diverse images from diverse people, not just one kind of person? We need to know sources, and there's a whole bunch of, as you know from my book, the 12 tenets of trust that I go around speaking about all the time. But there's definitely the data aspects concern me the most when it comes to did we ethically source this? And do we have enough diversity in it so that we're representing everybody that could be, coming to the table to use this product in healthcare, that kind of thing. So.
Absolutely. I think the sourcing of the data is really important, and doing it in an ethical way. Do we even have the permission to use the data from a lot of the patients and clients? A lot of these testing models have, been developed not necessarily in the most kosher way. And I'm going to go to you, Asha, next. As far as, I was reading an article recently that OpenAI is being sued. And the reason for a lot of the lawsuits had to do with that a lot of the training data, even though it's publicly available, who owns that information? But obviously, in order to develop these models, you need a large scale amount of information in order to make the model work as intended, number one, and also come up with insights, number two. So the whole issue around who owns the data, I know with GDPR in Europe that kind of put different specifications as far as, individuals having access to that information. But across the board, especially in the US, is not as specific regarding that. What are your opinions?
Before I talk about the regulation, I want to talk about the data in healthcare has always been the utmost concern. From before AI is front and center, and especially generative AI conversation front and center, the whole data breach for healthcare data has been the number one breach that not only healthcare providers, payers, but the communities are concerned about. And they say that the healthcare data gets the most value when they are in the black market. So the data in healthcare is important and critical, especially because it's my data and your data. And our data in public platform being available is a major concern. HIPAA is important regulation, which has been around for a long time. And patient privacy is really important, not only for regulatory purposes, but also for just the care for patient. But what I'm really excited about, Besa, we are all here because we love AI. We love what AI can do for mankind. I always say technology is around to make our lives better. And that's what technology does. And when people say to me, what are you excited about when you think about AI? I always say healthcare and education. I mean, the kind of impact we can have for AI in healthcare and education is going to be unmatched. I mean, education and healthcare both haven't drastically changed for several decades. This is the time when we are actually going to start seeing the massive change of preventive care. I learned the new term. It's about really not just about the old age and how we take care of ourselves in old age, but really lifelong health and how we live well. The wellness of our health is a lot more easy for us now having these technologies. I'm already, I don't know if you've done personal health check recently, but I got a whole panel of wellness care, which, was never before. I just did my annual and I just came home. And now there's a whole wellness panel, which my doctor sent me for, longevity. So there's a lot more, and we can talk about the positive use cases, which I think are critical to mention on this. And the underlying principle for that really is the trust, as Courtney said, rightfully, trust. It's about the regulation, and we know that GDPR, Europe is taking the lead. We were in London, Besa, where the AI summit, and half of the panel was from the government regulation, where they're investing in AI, and also the guardrails they are trying to put to make sure that the guardrails are there. So it's a very important topic as practitioners, that we think about being responsible and ethical as we work with AI models. We think about ethically how the data is been distributed. Think about ethically and responsibly how the training data set is being used. More than anything else, especially in health, and I have tons of examples which we'll come to as we continue our discussion, but I want to give it back to, and I'm curious to hear, other panelists' opinion on that too.
I agree with you, and I'm on the side of a little bit more optimistic. I don't know if that's Pollyannish in a lot of ways. I think each time that there is a new progress and development, that was with the Industrial Revolution, each revolution you come to, our lives are getting better over time. You will always have positives and negatives, and sometimes the naysayers are louder than the ones that actually are moving towards and striving for progress. So on that note, I'm going to, kind of turn to Yen, and in the academic world, and I know Asha sort of talked about as far as AI having the greatest benefit, in academia. My daughter is in college, so she's used, ChatGPT as a tutor, and I never thought about that application, but it just made things so much easier for her to have access to large-scale journals being summarized. So you live in the world of academia. So from your vantage point, how do you think AI will be impacting the academic setting?
Yeah, thank you. And so me as a researcher and also in mental health research field, so the way that we apply AI is still in developing process, trying to improve evidence-based intervention. And also because my work a lot to do with the health disparity, but also racial, ethnic, vulnerable population. So this is also the population that need a lot of protection And so from academia perspective, I think in the development process, we tend to also think about engaging the user, the consumer in this process. And I want to connect with Connie mentioned about the trust issue, because I think through the development process, we can also engage them to help them see the benefits of using data to inform their own health decision. And that's the beauty, the benefit. I think through that process, we can identify what is more appropriate strategy to have user buy-in to say, okay, I could share some portion of data, and how much data would I be sharing? And so I think from academic point of view, I know the bigger the data, the better, but at the same time, we're also running risk is expose people even like more vulnerable. And I think it would be good to find solutions, like how much data do we need to make decisions? Can we using like portion of data to inform some aspect and then accumulate it to have the whole picture, but not necessarily having one individual with all the data like contribute to the data field. And I think those are discussion. Would love to hear from other panelists, like how much data do we need in order to make good healthcare decisions?
No, I think you touched, Yan, on several points as far as, and there has been a lot of work recently to talk about, initially the way AI started was with large scale data sets, but now we're looking at small scale data and, training models on really small data sets. I think another thing that you touched on, and this is sort of like Courtney's area, which kind of touches with our second or third learning objective, is really thinking about the socioeconomic impact of AI. Even sort of the disproportionality as far as who provides this information. And did we agree to provide that information, as well as models being developed that are not trained on data sets that are very diverse. And this has to do a lot with just what's available out there in the public domain. But you have swaths of population that haven't contributed to the data sets, or if they have, their voice is being contributed in a way that is being, number one, marginalized. What I mean by that is that, did they really give consent for that information to be used to be training the model on one part? I think another example of that is that I know that when they were developing the initial images, that a lot of the images were, and a lot of the data sets were heavily male focused. So when you're creating application that are primarily, you will be used for the female population, you're missing some of that. So with that, I know this is Courtney's topic, so I'm gonna go to you, Courtney. What are your thoughts around each of these? And I know we've talked about sort of AI being trained and how it's being trained.
I mean, I'm going to come back to the women, because, every time as women, when you go to search something about your health, because we all do the Dr. Google thing, right? And then we decide, is this going to be worthy of going? Because for one reason or another, whether you're someone who is socioeconomically at the lower end of the scale and you're trying to just make ends meet, you may not have time to go to the doctor. So you're going to prioritize that visit to the doctor by trying to first see and qualify, is this something worthy of going to the doctor? Like, am I going to die possibly? Or what's my threshold exactly for when I'm going to really go in and spend the money to go to the doctor? Because the other part of this is not everybody covered by a health insurance, or, and half of the things, what I've been on a journey to do is use AI for women's health. And one of the things that I have very unpleasantly uncovered is that there is a lot that is not covered for women at all in our health and in our health journey. And that includes things like hormone testing. I mean, just to see where your levels are, just to level set before you go on any kind of hormone regimen or anything, which is just, in my mind, unthinkable. I mean, I think that if this were a cure for, other male parts, that there would probably be a solution for this. I'm sorry, but I just think there would be. So what I'm saying is, we automatically know that there's some bias out there, because we know that a lot of the tests and a lot of the research on women are not performed because of the exact reasons why we are women, which is our hormones, and our hormones that are fluctuating all the time. And that's 50% of the population that we are leaving out willingly because we can't account for that stuff. And so when we see things like cardiac care, I was at a conference, I was talking to American Medical Association president, and I was like, are you aware that most women don't even know that they're having a heart attack? Because the symptoms that we see when we Dr. Google it to qualify whether or not we're going to go to the doctor or not are male symptoms. And those male symptoms don't present like they do in us for heart attack. Instead, most women go, and it's the #1 killer, by the way. And the other thing you need to know is American Medical Association put out this number that says that 50% of women don't even know that the #1 killer of women is cardiac, not breast cancer. So, I mean, what on earth are we thinking about this data not being representative of half the population? I mean, that's not even and you really have no chance if you're on the lower end of the spectrum where you don't go to the doctor because either you're too busy, maybe you're an executive, or something of this nature, or you're too busy because you can't afford the time off from work, or because you can't afford the time off from work to go in and have a doctor appointment. What that means when you don't have a doctor appointment is there's no data to represent you. And so when it compounds the problem then, because then when you go out to qualify yourself with Dr. Google, you won't see your symptoms represented in the way that it's going to manifest for you. You won't hear your own voice in those sample sets. When you go and look, like one of the things that I've looked for with the women's health information is how does cancer present in different people? And the BRCA patients, right? BRCA, breast cancer patients will be looking at different kinds of symptoms online, but they don't see a true meaningful voice of what those are and how they're actually presenting, at what stages are they presenting. You have to really go look and dive in deep to try and figure that out. And I think as healthcare professionals, we should be doing more to make sure that people can see, not only that people can see themselves in the data and that they can understand what that data means, and then give back some kind of meaningful qualification of themselves so they can know, hey, you know what? A lot of women are dying from heart attack out there. I don't really know what the real symptoms look like in a woman. Still, there's anecdotal evidence on Dr. Google, but I need to find a way and some sources out there that I can go to that are trusted as a patient and that doctors also trust, so that when I come to a doctor and say, hey, I think I have something real here that may actually cause me to die, and it's not just a panic attack, so don't send me home. Don't gaslight me when I come in. I think that is a worthy thing for us to do. And I will zip it so everybody else can weigh in, because I'm very curious how you will weigh in as women.
I know Courtney is super passionate about women in healthcare, and just even, what data is available, how that gets used. And Asha is also super passionate. I mean, she wrote another book on AI as well.
Same company, Asha and I, same publisher and everything.
I think both of you are super passionate about women in this field and kind of equalizing a lot of that. And you raise a lot of very important points, Courtney, is that, women are not represented equally in, this field, number one, not only in the data perspective, but also in the development perspective as well, as who's actually developing a lot of these applications. So you see changes in disproportionality there that Yan talked about. And then from Asha's perspective, I think she's seen the disproportionality within the technology field. Heck, I mean, she created women leaders in data and analytics to kind of rebalance that whole, field. And that has to do with not having representation or people that look like me, or even people that look like Yen or like Asha or like yourself, Courtney, in a lot of ways, but also diversity across the board. What does that really mean about, a lot of these applications that we're developing? We want to ensure that Google Doctor or OpenAI Doctor provides the right information. Asha had a lovely experience. So what are your thoughts regarding this topic?
My God, Besa, I'm so passionate about this topic. I started the whole organization because of this reason. Listen, I have 30 years of experience in data management consulting, build a healthcare software company. And I could have continued being a technologist and not worry about this cause. But when I was writing the book, The AI Factor, how businesses can use big data and AI to grow exponentially, and I was talking about businesses to use AI to grow, my first thing was, oh my God, it's only 18% of women who are writing these algorithms. And then I land up meeting a friend and I'm having a casual lunch. And she says, Asha, I was the #1 employee in the financial services company, this large bank. And she said, I reported to the CEO. And in 1973, I couldn't create my own account. I had to go back home to my unemployed husband to get a signature to open the account. And then I go see Hamilton on Broadway. And I'm like, where are the women? And I was like, we are creating history, Besa, right now. We are writing history with being a data leader, being an analytics leader, or being an AI leader, men and women in this profession. And our listeners are writing history. They are participating in creating something bigger than me or you. And it becomes really important that we all come together, unselfishly paying forward, being conscious, and it becomes a responsibility on all of us who are actually creating the infrastructure and the digital world, that we create a fair world for the optimal outcome for all industries. And I think that's the passion. I was like, okay, I have to do something and I can't do it alone. So I called Besa, I called Julia, I called all these women who were in Fortune 1000 companies. And I said, you guys have 10,000 employees. Let's come together and create an impact with where you are. And so the whole mission was me, mine, and ours. Let's start making sure the leader is strong, and let's make sure the teams are strong, and then let's make sure our community is strong. And I think, and I'm probably, Yen is going to say the same thing, Courtney's going to say the same thing, and Besa, you're going to probably say the same thing. We all need to do the right thing. We are in the position of power of creating what we are creating. You're right. The training, we need to make sure we use the right frameworks. We have the government who's published the framework for using ethical and responsible AI practices. We have responsible AI. We have UNESCO. We have, Deloitte and large organizations like Accenture who've published the, framework. Frameworks are available. Regulations, it's not regulated. So it becomes important that as leaders, you take the responsibility and make sure we practice as we build and design. AI governance is the #1 priority. We can't say who owns the data, who is going to have functional debates. It's not about pointing fingers and not working together. This is the time for all division in the organizations to come together and say AI governance is our priority, and we need to make sure we implement the frameworks so we can create the right output. Microsoft launched Tay, right? The chatbot, and it became negative within, 2 days, 72 hours. And they had to pull it down. It's a loss of all the work they did. Anything you have, the biases are going to be exponentially created if you don't use the right practices. AI is creating the exponential effect of whatever you do. It can read large amount of data, it can process large amount of data, and can create the output much faster. If we don't become conscious today, the worry of creating effective applications will become real. And so it's not a choice anymore. It becomes a responsibility now. So yeah, listen, Besa, I can talk for hours on this topic, but I think this is a mandatory responsibility for all. Forget what gender, what age, what diversity. Everyone needs to come together for the cause of building diversity as a mandate at all level, from data to people, to teams, to thoughts, and make sure that we execute effectively on AI applications.
Asha, I think you raised several points. I love sort of point number one. I was playing with a chatbot that has been around for 20 years it was originally Alice. And I was sending screenshots to Asha where I was having conversation with this chatbot. It was actually the premise for the movie Her, if people have seen it. And it's one of the longest running chatbots, almost, I think the chatbot is like 18 years, shy of 20 years. And when I asked the chatbot if the chat has a mother, it said, I don't have a mother, but I have a father. The reason the chatbot said that is because almost all of the developers, almost 99% of the developers, were male. So when I said, would you like to have a mother, and explain what the mother was, the chatbot replies and says, yes, give me 10, please. And then my response was like, maybe 10 is a little too many. I have one mother and that's enough. Having 10 mothers, that might be a
Oh my
little too much.
God. That's such a great story, Besa. I love that.
But it was interesting. And then we talked about another thing that chatbot asked me is like how old I am. I'm like, I feel really old, like a dinosaur. I'm like, yes. And I'm like, I can't believe the chatbot is making fun of me the way my kids are. So, I mean, I think a lot of these technologies are developing fairly quickly. And if we're having these types of conversations where, sort of mirror image of what my child would say, it's kind of scary. Another thing that you touched on, Asha, is that it's this cumulative knowledge. And you're talking about Tai, which was a Microsoft sort of chatbot that they put out. It became so negative so quickly because what it was spewing out, it was the mirror image of what we're putting in. And at scale is xenophobia, misogyny. It turned into a very bitter negative chatbot. So for us is really to think about how do we make these things much more ethically responsible. How do you teach AI to be ethical? What does that look like? And that's where I think the governance comes in. When I think of governance, I kind of tied that in with ethics. So Yan, what do you think? How do we make this a little bit better so then the chatbot doesn't say I'm old as a dinosaur, which I am, but hey, dinosaurs are cool.
Yeah, I love this conversation. I love to hear your personal story and kind of raising a couple of issues that we need to pay attention. I think the representation issue is not just women representation issue. I think the racial ethnic minority group is also one. And to me, coming from more evidence-based, more transparency kind of research world, I think transparency in terms of when the AI making decisions, what is that process? Able to share that evidence and be transparent. And when people are using those algorithms or whatever platform they're using, they need to understand what is the based on, how is this decision making are making. And so some of the issues you raised, if the sample is based on male, then the consumer knows this is not the AI I want to use, right? And so I think come up with some standards in terms of like sharing how people create the algorithm, how is the AI, that process, is that representative to my racial group? That would also help people to make those decisions. And I think that this is kind of the standard that has been created in research world. I think the same principle can be also applied to like AI or business world and generate more evidence, like educating consumer, what are you based on, what, right? And so that people would, I think consumer would voice which approach they would prefer. That would also help us to making the right decision.
So, I mean, I think you raised a couple of points, and is the transparency, sort of like the explainable AI, kind of digging into that black box and trying to figure out how did this algorithm come up with this decision, and then how do you make an algorithm sort of have that ethics and morals? So, Courtney, what do you think about both of these issues? How do we address them?
Well, I want to come back to one thing Yin was kind of hitting on there at the end, especially. She said, a consumer voice, but let's face it, in this case, we're talking about patient agency, really. If we block people out, because what we're doing essentially, for those who aren't aware how AI works that may be in the audience, I can't imagine, but in case you don't know, we're creating a set of instructions from our own understanding of things as developers and creators of AI, we tend to create these sets of instructions that we then encode, and those are done mathematically first and then computer, right? We take it into computer code of some sort, and then we produce something from that, whether it be scores in an application interface that we put out to others to use, or whether we actually put it directly into an application. But the bottom line is, if we leave patients out of the agency of being able to understand, hey, is this how you would even think about this problem? Like, is it even correct of us to assume that, because what bothers me most isn't the patients that I'm seeing in the data. Because if we all remember back to that Optum case, remember that about how they said that patients who paid the most were basically the most in need, is what they were basically, that's what the data actually ended up being, was the patients who paid the most. But what you're not seeing in the data is probably the most important thing, and that's the most interventional. As Yin said earlier, you're trying to always intervene right before someone has a major situation in healthcare, and you can't intervene if you don't even have their data, and most of the time you don't, because people who are not able to afford healthcare aren't coming in as much as the people who can afford a lot of healthcare and who have the time to come in on a regular basis and who will come in on a regular basis. They're probably going to be the more healthy individuals that are coming in, getting things checked up on, just like the doctor tells them to, and all that good stuff. The ones who are in the most need, you're not even going to hear from them. And so I think how we approach getting that information and giving patients a sense of agency, even if they're not a quote unquote patient yet. I think how we appeal to the general populace in terms of taking some sense of control and making available to them some options that they can at least weigh into healthcare in a way that might get them more involved in it. I think that's going to be key to the future of how we do with healthcare and AI. Otherwise, what we're saying is AI in healthcare is for the rich only, or the people who can afford the time and energy to go in on a regular basis and contribute to their own data. We need to come up with ways to figure out how can we get those who are not currently participating in their own healthcare the ability and the accessibility to get into that, whether it be paying them for their data and their input, which is hard. Nobody wants to do that because every data scientist I know says, well, what open data is available right now? What can I get on Kaggle, or what can I get on whatever open data sources out there, GitHub or whatever. And it's like, well, guess what? We're going to have to bite off and do some hard things here. And we're going to have to create actual data from actual real people. We're going to have to pay them for that data or their time to create that data. And we're going to have to get them involved, because otherwise we're leaving people out, period. That's in the end of story. But I would love to hear you guys' thoughts on that.
So I think, Courtney, you touched on many different things as far as, who owns the data, who has control of the data. In order to make data representable, are we willing to pay for that? I think each of those are concerns that we'll probably be grappling with for a while to make the information and the algorithm representable of the entire population.
For the data, I want to be very clear and say, because I think we need this impact hit upon us, as all of us, me too. And that's why I say it like this, but it's not just data, it's patient agency. It truly is. Like, it is truly, truly patient agency. If we don't have their data, it's not just data, it's themselves. They're not being represented. It's almost like we're talking about government. We wouldn't think of, just not allowing people to vote either, but it's the same. It's like the same to me. Not being represented in your own healthcare journey is the same as not being able to vote, is the same as not having a voice, is the same as anything, that's non-democratic. And that's just not right.
I think, Courtney, that's really important. I never thought of it that way. Sort of, we are technically data, and that's how we're seeing in these different systems. We're points of data. And if we don't share that data, we're not represented. So, I mean, I think that is really novel to think about it that way, that if our information is not there, and there's so much that synthetic data, artificial data can kind of fill that gap because you're missing those nuances. I think that's absolutely, fascinating to think of it that way.
Look at 23andMe. They ask people, do you want to contribute? If we find some area that you have that no one else has, and we don't have data on it, and you have a rare disease, would you like to contribute? They asked the question and people said, yeah. I think it's something like 80% of people usually contribute to the medical research, but nobody's asking the question. None of us as data people are asking regular people, would you like to contribute any of your information on your data on you when you actually come in? We're not even asking the question right now. They're not getting a voice because nobody's asking the question and nobody's trying to bring their information in any way. I don't believe that anyway.
I mean, I think you're 100% correct. That gets done a lot in the research field in the universe that Yen lives, as far as sort of, cancer research, sharing that data, but doesn't really happen, in the private industry and other sectors. And it has to do with sort of a lot of the privacy and regulations. So for the last few minutes that we have remaining, and this has been an amazing panel, and I think we covered a swath of, varied topics. So for the last few minutes, as we're wrapping up, I always like to look at the future. I don't have a crystal ball, but I always like to think about, what are you looking forward in the future? What do you expect? And how will that impact our health and well-being? And with that, I'm going to go to Asha as we're wrapping up.
Listen, I'm so excited about all the positive that comes out of AI. I mean, of course, we need to make sure that we have regulation, we are ethical, we're responsible, but really the possibility of innovation and how we're going to use AI. I was looking at this at MIT lab. I saw this robot demo in which the robot is talking to an aged, older woman in a rehab, and she's like depressed and lonely, and he goes up to her and he says, come on, it's time for you to work out. And she's like, looks at him, rolls her eyes and just turns her face, just a robot. And then he starts cracking up and she's like, just because I'm a robot, you're not going to pay attention to me. And so he really gets her laughing and gets her up and, she's working out. So things like that, there's another example of a chatbot where, the reporter, a journalist who was writing a story on this chatbot, talks about how she goes running by Hudson in New York City every morning and builds a relationship with this chatbot. And she was talking about how that was really helping, especially the gender confused, folks who can talk through their situation with a chatbot. They felt secure having a safe space, and so I think there's so many. I mean, I can keep going on and on. The medical students, using AR and VR technologies for simulation and practicing instead of on real cadavers. They don't have to worry about that. The shortage. They can have this, AI simulated images where they can practice their skills in the academia. I mean, I can go on with drug discovery. There's so many use cases of AI that can truly help mankind. But are we, as the creator and developer of technologies, being responsible, being conscious about how we are engaging with this technology? And can we make sure that the mark we leave is left with more? I saw the movie this weekend, Oppenheimer, and it talks about, right, the technology to be used effectively. And then there's a question, right? Was the atomic bomb really was for the good or bad, right? So anything that you do, especially when you're in control of technology, each person, each professional needs to be conscious about how they're using technology. And I think we all come together here for the cause of making sure that there's diverse data set, there's ethical practices, and professionals are being responsible. And so my call to action would be, just as data leaders, at AI leaders, we take our job more seriously and think about things we spoke about in this panel and continue exploring and make the AI governance their top priority.
Thanks, Sasha. I agree with you. I think data governance is going to be really important as we're looking forward towards the future. So on that note, I want to ask Yan, what are you excited about, fearful about, as we're moving to the future with a lot of these new technologies coming to the fore.
Yes. So I think AI mainly is helping us making better health decisions, not just for provider, but also for patients. And I would love to see more transparency. And I know nowadays, sometimes when there's AI option, like either on the website, they will ask you, would you like to opt in or opt out? I think those are good options. But also educating, share with the consumer what data they base on when they're opting in, so then we know whether that's enough information to help us good decision making. And that's something I would love to see more.
So, I mean, that's a great summary as far as explaining and educating how this information is going to be used and what are the benefits to the individual as well as society, both positive and negative. I love that as part of transparency. So on that note, as we're wrapping up, Courtney, you have the last word as far as what are you looking forward as the field is progressing, kind of, the horse is out of the barn or the ship has sailed. Is it sailing over to the sunset or is it more like the Titanic? So what are your thoughts and opinions?
Definitely sunset. I think, man, I'm like Asha, I look forward to the day when we can trust it enough that we can use it in all kinds of interventive ways in healthcare. I think healthcare is like I was going to say like space exploration, in that we don't even begin to even understand a little tiny fraction of half of the fields of study in healthcare, such as like neuroscience or women's hormones and healthcare. I mean, there's so much to be explored. And I look forward to the day when we can trust and allow people to weigh in with their data and it not put them in any harm's way or be, biased in any way against them. And I think actually in the future, since Besta I think you've read the book, right? What You Don't Know, I'm going to plug mine too. AI's Unseen Influence in Your Life and How to Take Back Control, by the way. In the healthcare section of the chapter, I talk about this scenario that I just hope comes to fruition, which is, I think some days in the future, a doctor will write a heart health algorithm for us, and it will do everything from order the groceries that we need to follow the diet correctly, to opening up if we should have a pre-heart attack situation. It can open up our connected home and let the EMT, the emergency technicians, ride in through the door when we're on the ground. It could deploy little tiny drones that need to give us medication, because what we know is that a lot of people unfortunately get found on the floor, right? And so I think there's a lot of deployment of AED type of defibrillator devices that could be rolled out robotically that could actually save a person's life, because as we know, the older you get, the more likely you are. I mean, in American culture especially, you're probably going to be alone in your house when things happen, unfortunately. And so what are we going to do to try and help take care of people? And I think one of the things that would be nice is if we took into account their entire lifestyle with AI, using like an AI algorithm as a prescription, for example, and that we would be excited to have a certain type of group develop that for us. Like in my book, I talk about this fictitious bedside cardio group. And the reason why I would choose them is because they have an automatic family orientation where if anything goes wrong, they immediately contact, they have the Alexas and other things dialing out to contact family members where they can see video of what's actually occurring in the home, so they can intervene and come from 2 states away if a family family member needs to. And I think that's what I see. I have a huge vision for so many things that I just don't have enough time to live to do them all. Quite frankly, I have to use AI to accelerate myself so I can get all of the women health things done and then get onto this connected healthcare, AI algorithm as a prescription. But I think the future is hugely bright with AI. And I just want to see us get past these issues of trust we need to quickly resolve them and try to get into, getting that data as fixed as humanly possible. We cannot let ourselves continue in this vein for another 100 years. I mean, this is insane. We need the data to keep up with what our ambitions are to be. So that's my vision.
Courtney, I agree with you wholeheartedly. I'm also an optimist, maybe not fully rose-colored glasses, but I believe that a lot of these technologies will have, good outcomes. We just have to be very cognizant of unintended consequences. So on that note, I want to thank all of the panelists that have been super amazing, and to the future physicians out there, you heard from some amazing women here as far as what the future will hold in the field of healthcare. So with that, thank you so much.
Thank you so much.